Come in.
Hey, I am Angie Pate. I am a nurse practitioner, family nurse practitioner student from Jacksonville State University. Can you verify your name and date of birth, please?
Type A, February 11th, 1973.
Okay, what brings you to the clinic today?
I'm a new patient.
All right. Do you have any allergies to medications?
No,
Are you taking any medications?
no,
Do you have any issues? We're going to start with your assessment of your heart, lungs, and chest. Have you had any issues in those areas? Any chest pain
no.
or shortness of breath? Okay. What I'm going to do is I'm going to start with an inspection of everything. So I'm going to need you to take off your shirt. So I'm going to step out, give you some privacy, and let me know when you're ready for me to come back in.
Okay, I'm ready.
Okay. I'm just going to take a second to look at everything, so I'll let you know if I see any abnormalities. So I'm going to look at the landmarks. I'm looking at the trachea and the sternal notch, the angle of Lewis. I am looking at the costal angle. I am going to, can you cross your arms across your chest? I'm going to take a look at the C7, T1, which looks good. I am going to take a look at the AP diameter to make sure that it is half the size of the transverse diameter. Let me look at this side. And it does look to be half, so that's normal. Okay, you can just relax your arms. I'm looking for size and shape, symmetry of the chest. I'm looking for use of accessory muscles with breathing. Looking for any prominent ribs, skin color changes such as cyanosis or pallor, and everything looks to be good. All right, now I am just going to feel around on your chest and let me know if you feel anything that feels sensitive, okay? Any sensitivities?
No.
Okay, all right. I'm gonna take your pulse real quick. Okay, pulse is around 72. Respirations look around 18, which is normal. I'm gonna take my hands now and I'm just gonna put them on your abdomen, and then you're just gonna take a few breaths, and I'm just gonna check your thoracic expansion, which just means how your chest is moving when you breathe, making sure that it's symmetrical. Okay. Okay, one more time. All right, that looks good. I'm gonna do it from your back. You can turn a little bit this way. All right, go ahead. Okay. One more time. Okay, good. Everything looks normal there. Now, what I'm going to do is I'm going to take the palms of my hand and I'm just going to feel down several areas on your chest and back. I'm checking for fremitus, which if it's supposed to be normal, normally equal on both sides. So I need you just to say 99 repetitively for me.
99, 99, 99, 99, 99.
Okay. Okay, repeat 99 for me.
99, 99, 99, 99.
Okay, everything feels normal, symmetrical. Now what I'm going to do is I'm going to take my finger and tap it down your back. And I'm going to be measuring your diaphragmatic excursion. And so then I'm going to make a mark. You're going to feel me make a mark. And I just need you to cross your arms over your chest. And then when I say, I need you to take a deep breath and hold it for me. Okay. Now exhale. Now what I'm going to have you do is take a deep breath, exhale, and then hold. Go ahead. Deep breath, exhale, hold. Okay, breathe normally. Now when you're ready, we're going to do the same thing on the other side. You ready? Hold your breath. Okay, exhale. Now just when you're ready, take a deep breath and then exhale and hold. All right, I'm just gonna measure that real, you can breathe normally. I'm gonna measure that very quickly. Okay, 4 centimeters. 4 centimeters, so those are equal. One side, the right side is lower because of where it sits on that lobe of the lung. All right, now what I'm gonna do is percuss all the areas of your lungs on your back and in your front and on your sides. So if you will cross your arms over, and I'm just listening to make sure that all of them sound resonant, nice and clear. Okay, I'm just gonna do a couple places here. Maybe listen to this one over here. Okay, compare it to this side. All right, sounds good. Now just relax. I'm gonna do it on the front. Okay, everything sounds good. Okay, now what we're gonna do is I'm gonna take my stethoscope and listen to several areas in your lungs. Just relax and breathe normally. Do the same thing on the back. Cross your arms across your chest. Okay. Okay, so I don't hear any adventitious sounds or any abnormal sounds, like wheezes or stridor, crackles, anything like that. Everything sounds nice and clear. Now what I'm gonna do is I'm just gonna take a look at the area over your heart called the precordium and just look at some different things. So I'm gonna use this light. Just roll your shoulders back for me. Okay, I'm looking at the sternum, the sternal border. I'm looking for the apical impulse, looking at the epigastric area, looking at the axilla and where they are, everything's symmetrical. Looking for any heaves, lifts, everything looks normal. It looks like by the apical pulse that it's about 78. Okay, now I'm gonna have you just lie back for me. I'm gonna take my hands and I'm gonna just feel in different areas, okay? Don't feel any thrills. Everything feels good. You don't have any sensitivity or anything in that area? Okay, now I'm just going to listen to your heart in several areas with both sides of my stethoscope, so this may take just a second. The aortic area, the pulmonic, herbs, tricuspid, mitral, Listening to S1, S2. Everything sounds normal. Rate seems to be about 78. I don't hear S3 or S4. I'm going to listen with my bell now. I don't hear any S3 or S4. No murmurs seem to be present. Can you turn to your left side? Scoot this way just a little bit. Turn on your left side just a little bit. Okay. Okay, everything sounds normal. All right. I'm gonna step out and just let you put your shirt on real quick, and then I'll be right back to just talk about all of our findings.
Okay.
All right, so everything seemed normal. Do you have any questions about anything that happened during the assessment?
No.
All right, well, I appreciate you coming in to see us, and then we'll just see you next visit.
Thank you.
Okay, thanks.